Nathan Schramm. He opened his business a few years ago, and he was lucky enough to find us, and we were lucky enough to know about him. And I think his business, when he started, it built to be a tremendous business. He's very successful. He's doing very well. He's always giving back to the community. I know when the people come and knock on the door like me, he's always there for us. He's my eye doctor, great glasses. My daughter picked him up. From 2 years ago, I can select not even a pair of underwear for me. My daughter said, oh, my wife does that. But anyway, that's the lucky part, right? But I would like to introduce him. And first, before I do that, I want to thank you very much. Because the partnership we have with you, this man is customer service 100%. 100%. I mean, we talk about ideal customer service, and that's what it's all about. And first of all, I want to name of Americans. I want to thank you for your support. And you got 5 minutes. The timekeeper will let you know. He doesn't even give you a second extra. So thank you very much.
Thank you for the kind words. Thank you, mi America familia. Estoy aprendiendo español. My name is Dr. Schramm from Naturalized at Weston. I'm an optometric physician, certified nutrition specialist, and a fellow of the Scleral Lens Education Society. What I want to talk to you today a little bit about is myopia and some of the problems down the road with myopia, which is nearsightedness, and the epidemic in this country with children developing myopia. This photo is really not accurate. All these kids, most of the time, they're wearing glasses. That might be a better accurate one there. What I'd like everybody to do is stand up, just like they're doing in this photo. And if you need to wear glasses to function, or contact lenses to function, because right now they say about 40% of the population needs to wear glasses or contact lenses if you're between age of 18 and 44. Go ahead and sit down if you have to wear glasses or contacts pretty much all the time to function. So that's actually more than 40%. Okay.
Not everybody's sitting.
Not everybody. Well,
yeah.
The people that are sitting, if you're nearsighted and you guys were to get married and have kids, you got about 75% in this day and age, 75% chance that your child is going to need to wear glasses, spectral correction. For those of you that are still standing, if you've had LASIK or refractive surgery or cataract surgery or something that was done to your eyes so you don't have to wear glasses or contact lenses, have a seat. Nobody, okay. Now, the rest of the people, if you only have to wear part-time for certain functions, go ahead and have a seat. So now everyone who's standing, everyone who's standing has perfect eyesight or is in denial. The ones that are standing, if you were to get married and have kids, you'd have a 25% chance of having kids that are nearsighted. If you were to marry somebody who was sitting down, it's about a 40% chance of having kids that are nearsighted. What's that? So, and the ones that are standing, it's even more important for you guys to be coming in for eye exams because most likely it's been a while. You guys can have a seat. All the ones that were standing there, we have a special. Seriously, we do have a little special gift for you. We'll have to see. You'll see Lourdes or Maricela at the end. This, to be serious for a second, this is a lady who has a cancer in her eye, 35 years old, Hispanic female, and we saved her life. I get really stressed about people not wanting to have their eyes dilated because without dilating this patient's eyes, and she didn't want to be dilated, she would have died. So. You want to know whether you have myopia or hyperopia? Back to a little bit more lax of a subject. If you have, can people see the E? Are you able to see the E? I don't know if the screen is big enough.
Also the 10.
It's not really a true chart. But if you want to know whether you have myopia, take off your glasses, and if pretty much things have gone pretty blurry, you're probably myopic. You might be farsighted, hyperopic if you're older. When you get older, it gets harder to see from far away and reading. So if you're myopic, just grab a business card, or everybody grab a business card. And if you see it clearly, then if it's blurry, if you see it clearly, then you're probably myopic or you have good eyesight. If it's still blurry at arm's length, bring it in until it gets closer. At some point, it will get clear. That means you're myopic. If you're myopic, you can see things up close but not far away. I got a minute left. Okay, so with myopia, you're about 22 times more likely of having retinal attachment with higher degrees, 3 times more likely of having glaucoma, and we can stop this or prevent this in children. Since 1971, there's been a 66% increase in myopia, nearsightedness. Now there's a myopia control clinic in Berkeley, California. I have one at my office at Nearsightedness at Weston, where we try to prevent myopia. It can be done with a special retainer that's worn only at nighttime. No surgery, no glasses, no kidding. The only time they have, and no daytime contact. So they only sleep with it at nighttime, and they see clear the rest of the day. So it's really amazing technology, and we do it a lot on children because it helps prevent their eyes from getting worse each year. When I first wanted to become an eye doctor, we don't cure much in medicine. We don't cure much in medicine, but when you put glasses on or contact lenses, it's almost like a cure. Now we know that the eyes get worse every year with kids. Most of the time they get worse, so we have a special retainer that can help prevent that. And also, less sugar, get your kid outside playing, and that can help prevent nearsightedness. I have the lecture here if anybody wants a copy of it, and I'm going to pass around these glasses if you want to look. Make sure there's all 6 of them back at the end. Thank you very much for your time.
Thank you very much.
When you say children, what age are you saying?
Children at worst, the younger they start, the worse they're going to get a degree of nearsightedness or myopia. So, they should be seen at 2 years old, just before pre-K, kindergarten, and every year after that, up until the age of 18. But people still get worse in college, too.
Can you explain one more time what's the retainer for kids? What is it exactly?
It's a really small, it looks like a contact lens, but it's smaller than a contact lens, and it reshapes the eye. Similar to LASIK reshapes the eye, but it's a temporary effect. So as long as you wear it at nighttime, in the morning you take it out, you see clear the rest of the day. It has to be worn every night.
Can I collect my notes?
Yeah.
Awesome. So set up a